ask what the patients want. And what they want is interesting. Let me tell you what they don't want was not important as read. They don't want surgery. They don't care about physical therapy or medication or diagnosis or even their physical examination. What they want is improvement in their pain, improvement in function, and to know what the heck's going on with them. That's what they want. And chiropractors are really good at that. They're really good at it. Matter of fact, I'd almost say they might be too good at telling them what's wrong. Because we take, in chiropractic in the field, we'll take x-rays, and oh, here's your problem right here. Oh my gosh, this is the worst spine I've ever seen. You've got spurs big enough you can hang your hat on. You've got a degenerative disc disease, and we scare the crap out of our patients. When you do that, it actually increases patient satisfaction because they know what's wrong. But you also just interfere with care. If we had two patients here with the exact same condition, I took an x-ray of this one and not this one, which one's going to get better faster? And when I didn't take the x-ray, all things being equal. And if I show them the x-ray, it's even worse. And if I do an MRI, it's even worse. Take an MRI, because you're going to find something wrong. MRIs are so sensitive, you're going to find something wrong. And so what I would challenge is, it's not, and I don't think it's, I love imaging, by the way. I don't think it's the x-rays. I don't think it's the MRIs. It's what we say with our mouth that changes what happens. And for most radiographic studies that are done, they're requested by the least qualified person in the healthcare system. General practitioners, internal medicine docs, they're really big on data. Oh, you got a back problem. Take an x-ray, MRI. Oh, you've got degenerative disc disease. You've got, osteophytic spurs. You've got a bulged disc. And they have no reference to this. All the patient said, I've got a bulged disc. How many times has somebody come to your office and said, oh, doc, I've got a herniated disc? When was it diagnosed? Oh, 20 years ago. It locks in there. You have sentenced that person to a lifetime of catastrophizing, how I can say that word, of catastrophizing their condition. Your words have power. My belief is, look, you guys are familiar with the studies, they've been quoted at this conference. Those x-rays are not part of the care we should provide. I think that if we all use the correct words, the x-rays aren't the problem. We're the problem. Certainly the internal medicine docs and the family practice docs and nurse practitioners who don't have your background are part of the problem. If you simply read a report to somebody and you don't put context to it, you just scare the crap out of them. So where's that power? So what I would ask of you is you use words that are nuanced. Yeah, you've got a herniated disc now, but in time this is going to get better. Most people get over these things and they're back to live their life as normal. Make sure you use nuanced words. Don't use words that are going to necessarily scare them. And just think, you all know the chiropractors who scare their patients with these terrible findings. Oh my gosh, there's a spur there. Big deal. But you get better compliance, and the patient's more satisfied because they know what's going on, but they're not going to get as well as we'd like them to. Give them perspective. Yeah, these happen all the time. It's normal for discs to bulge. Discs are meant to bulge. Everybody's disc bulges. It's part of growing older. But that doesn't matter. It doesn't mean they're going to hurt. And give them hope. Always make sure that you give them the path. Let's say they come in, you have an extruded disc. About 3 months, they're pretty bad. We're going to help you get over the period where most people make the decision to get surgery. And in 3 months, it's probably going to regress quite a bit. You may have some lingering pain with this, but we're going to work on this with exercises and chiropractic and basically some advice. Finally, avoid catastrophizing. And my in-laws, lifetime chiropractic patients, they go to a new chiropractor. Oh my gosh, this is the worst spines I've ever seen. We're going to put you on an 18-month course of care. They move to a new place. Get care. Move to the next chiropractor. He says the exact same thing and gives them the exact same program. Scaring the crap out of the people should not be part of your practice management. So we're here, like in the matrix. You decide, do you want to keep going the way you are, knowing that that's going to help your practice, or do you want to get people better? So in this case here, what would you recommend to this person? He's 66 years old. He had